Welcome to Canada, where we have free healthcare. Now I'm going to tell you what comes along with that free healthcare, because friends, nothing in this life is for free.
The Canadian healthcare system has actually shook me to my core and has scared me so much that I feel like I'm paralyzed.
Today on How Fucked is Canadian Healthcare, I need an MRI to see if I have a fucking brain tumor. And go ahead, guess when it is.
It's in 2026.
The Canadian healthcare system has a problem, and as at of the time of recording this video, this healthcare system needs scrutiny today more than ever. Random Canadians are going online and giving negative reviews on their healthcare system. They're saying that the whole healthcare system is a scam and it's not as effective as the government claims it to be.
The Canadian healthcare system will quite literally be the death of me, because I truly am just baffled by how things work here, and I can't.
Now in this video, we will be checking out some people rant about the healthcare system in Canada. And as they rant about the whole healthcare system scam in Canada, I'd want you to watch with a keen eye and also kind of scrutinize whatever they are talking about, because that is only one side of the story. I've had cases whereby people claim that the healthcare system in Canada is not the problem, because healthcare in Canada is kind of provincial. So if somebody in Ontario is complaining, then it's a provincial problem and not the whole of Canada. Some provinces in Canada claim that they have good healthcare system. So please, as you watch this video, be keen and help me confirm all these. Let us have the conversation going so that we can be able to separate myths from the truth.
Today on How Fucked is Canadian Healthcare, I need an MRI to see if I have a fucking brain tumor. And go ahead, guess when it is. Go ahead, guess.
It's in 2026. 2026.
My MRI to see if I have a brain tumor is in 2026. It's March 2025 right now. And if you thought this was bad, it's actually worse than you thought, because the appointment where we decided that I need this MRI was in December of last year. So it's not like it's 10 months from now, it's 13 months. It's a 13-month wait to see if I have a brain tumor. At first, I just thought this was a mistake, because having an MRI every year is like a monitoring timeline. Like, I already have an MRI every year for my spine tumor, which is why we think maybe I have a brain tumor too. So I was like, hey, they just made a mistake and scheduled this on a monitoring timeline. But no, I called and the clinic was like, yeah, the doctor actually requested that you have it earlier, but this is the next spot we have. We're seeing about 13 months for these brain and spine MRIs. Cool. Cool, cool, cool. Canada, where healthcare is free, but only if you can afford to wait.
Have you ever left the doctor's office just feeling like you weren't heard, or like they didn't care, or that like they just, I don't know, didn't believe you, or they were undermining your symptoms or anything? Because this is like the fourth time that I've seen a doctor for the same issue, and what he did was basically just prescribe me more of the medication that I was taking, which is basically just Tylenol. Like, I feel like, at what point do we decide to like look at the actual issue at hand? Like, at what point do we decide to do, you know, the x-rays or the MRIs? I don't know. I'm not a doctor. I'm not a doctor. And that's why, like, I feel like I can't, you know, like, argue back or stand up for myself, because I don't know what I'm talking about. That's why I came to the doctor's office, you know? Anyways, I just needed to vent. If anybody's a doctor and can tell me why I keep getting jaw and like headaches, earaches around here, if anyone can tell me that, let me know, please. Welcome to Canada, where we have free healthcare. Now I'm going to tell you what comes along with that free healthcare, because friends, nothing in this life is for free. As a Canadian who's lived in Canada most of my life, wasn't born here, but I was raised here, I will tell you that free healthcare is not as great as you may think. In fact, I think it's actually named incorrectly, and it should be named free emergency care, where if you have a very serious emergency and you need surgery, yes, it is free. But my friends, that's also named incorrectly, because our taxes are so damn high in this country that you're already paying for it. Want to know what else you get with free healthcare in Canada?
long ass waiting times everywhere. Want to go see your doctor? Especially during cold and flu season? Prepare yourself to wait 2 to 3 hours, sometimes even more. Your kid has an emergency, so you decide to drive to a children's hospital? 6+ hour wait times. Just to be seen. That doesn't count the diagnostic and anything else that needs to be done if your child needs anything else. Want to see a specialist? You can't. Your doctor has to refer you to the specialist, and the government monitors how many times your doctor refers you to XYZ places, so your doctor is very cautious of where to send you. Sometimes, most times, not sending you at all. Children don't have pediatricians here unless they have a problem. And when you do finally get a referral for a specialist, your wait time is anywhere between 3 to 8 months to see the specialist. And then when you finally see the specialist, the wait time if you need some sort of surgery or procedure is another 3 to 8 months. I don't know about y'all, but for a citizen of this country that pays up in taxes, I find these wait times absolutely atrocious, unacceptable, and disgusting. Now, I'm not just telling you these things because I heard some people talk about it. I'm telling you these things because I have personally lived it. So I don't know about y'all, but I think this shit's criminal. Healthcare in Canada is not free. You're paying taxes, very high taxes, but you're not seeing the result of that. So the next time some Canadian tells you that they're so proud to have free healthcare system, ask them if they have a brain.
Canadian healthcare system has actually shook me to my core and has scared me so much that I feel like I'm paralyzed. I recently had to go to the hospital for a health scare I had, and I can't believe the state of our healthcare system and how bad it's gotten. First of all, I went to a hospital, and it's near where I live. I don't really want to name names of where I went or anything, but if you had closed my eyes and told me to open them and placed me in this hospital, I would have genuinely thought I was in a developing country. Like, no way would I have thought I was in North America, or I was shocked. Everything was falling apart. It was dirty. There was like little, I don't know if they were cockroaches or little bugs just crawling on the floor. It was so scary. And then the wait times and the amount of doctors for how many people that need a doctor, it's madness. And I understand this is systemic and macro level. It's not like the doctor's fault or the staffing or anything like that. But there was about 70 people who were in Emerge who clearly felt they had an emergency that had to wait for one doctor. There was an 11-hour wait time to see a doctor. I was triaged for this emergency that I had, and then I was in pain and this, and I was basically told, like, nothing can be done, you just have to wait to see a doctor. And I was like, can I have medication or anything? Like, can I just at least know, like, X, Y, and Z? No, all you can do is wait. I'm hesitant to talk about this next point, but I just feel like it needs to be said. I just want to preface this and say that I am a healthcare worker myself. I worked all throughout the pandemic. I understand high stress, short staff, minimum. I get it. I do, 100%. But bedside manner and empathy have completely gone out the window. A lot of the staff I dealt with were impatient, rude, they were lacking empathy completely. And I get it. You're probably overworked and you're short staffed. I do understand that. But if someone's in Emerge or at the hospital, this could quite literally be the worst day of their lives. And I get you're tired. And I understand that, you know, your coworker probably called in sick and you're pulling a double. I do. And I understand that not everyone's really kind to you and people can be very rude to you and you have to deal with that. I understand it. But kindness and just general human behavior, like treating someone like a human, I don't really find that anymore. So I just feel like I'm in this catatonic state where I'm just like, I can't believe this is just the healthcare system of my country. It scares me like so much. And because of wait times and everything like that, people will now start avoiding going to the hospital. And that's where like real problems tend to happen. So I don't know what the solution is. I mean, I'm a part of healthcare now. I hope to be a part of that solution, but I don't want to use this platform to come in here and like bitch and talk about like experiences and stuff like that, but I felt like I had to say something. It was such a traumatizing experience.
Well, having watched these videos, not everybody is in support that the Canadian healthcare system indeed has a problem. Some people claim that it's just a provincial problem and it's not the whole of Canada, and some people claim that it's the wrong choice of doctors and wrong choice of hospital, that it's just a hospital problem and not whole country's problem. So watching the videos, I kind of dived into the comment section, and this is what I came across. Well, while some people claim that the whole problem is not even real in the first place, they do claim that probably some specific provinces may be having this problem, but it's not the whole of Canada. While they do make those claims, I've also seen videos of people who have been hurt to the core. They claim that whoever thinks that the healthcare system in Canada is effective or it's working, then that person has simply not been sick. All those who think that it's okay and it's quite functional are people who've never been sick, and they have not yet interacted with the free healthcare system that exists in Canada. Other than that, there are also claims that the healthcare system in Canada does not support those people who are supposed to be making the whole healthcare system to be functional. I'm talking about nurses, I'm talking about doctors, and all the workers practicing medicine. Now, according to claims, they do not even want to be given the upper hand. They want a system that will just stop victimizing them.
Healthcare is not made for single moms. I'm Dr. Anderson. I'm a Canadian family physician, also a single mom to 3 kids, one with special needs, cerebral palsy, intractable epilepsy, G-tube, nonverbal. Honestly, burnout for me in healthcare has been because it's very difficult to work as a doctor and look after kids, especially with custody agreements and the additional needs of a special needs child. I had to stop my family practice because my kid was too sick at one point for me to even show up to work. It was the most horrible thing because I loved my patients. I did everything from hospital work, obstetrics, I delivered babies rurally, and I had my perfect practice. All ages, a lot of different interesting people. I had patients that would, they'd bring me baking and coffee, and I had just your typical rural practice that was amazing. And I loved my patients. It was the most horrible thing I had to do was to quit my practice. But what I did, and I was glad I was a family physician that kind of did everything, I was able to go to just working shift work in the ER. And I continue to do that to this day, over 10 years later. Because even now, every time I try to do clinical work, the demands of kids and the demands of a special needs child, for example, getting him to and from school. It has to be I have to bring him to the special needs bus. I have to be able to pick him up on short notice. I have to arrange respite. Not just anybody can look after him. They have to be trained in seizures and G-tubes and all these things, right? So I literally, if I want to do a clinic day, I have to work from 10 till 2. And I try to put extra people in if I can, but a lot of that happens the week before, depending on whether or not I've had childcare or I have somebody else that can pick them up and stuff like that. But, I saw another TikToker post about how this world is not made for special needs kids or for single moms, and I agree. Because there was 1 year when I broke my leg 2 years ago, and it was literally impossible for me to not work. I had the type of break that couldn't be walked on. It wasn't safe for me to be in the ER by myself at night. I had 2 ER jobs. One of them in the city was great because you get sick time and things like that. And and there's a lot of people to cover. My rural job though was like, oh well, you have to get rid of your own shifts, and there was like nobody to work. Even though I had letters saying, that I couldn't do much with one leg, especially if I was on by myself. And, just the stress involved with having zero help with even trying to get rid of shifts and that, I literally just dropped them. I was like, you know what, this is ridiculous. I am working on getting myself better. The other time was when my son was super sick. This was during COVID, and he did have COVID at the time. And nobody would look after him. I couldn't get any respite people. And I was like, well, I can't come to work because he was like 10 or 9 at the time. I was like, I can't leave him by himself. I can't have any childcare. And they're like, well, you have to work anyway. Like, figure it out. And I was like, yeah, no, I can't. Like, I'm sorry. And with custody agreements, it's like, if I have him, I have him, and I have to have childcare. So like Christmas and all the times when it's impossible to find childcare, I was trying to navigate custody agreements and when I was supposed to have him and work. And like work is just inflexible. It's like you have to work. If you can't work, you have to get rid of your shift. But by the way, there's nobody to take your shifts because we have 0 staff. So it is, I have been advocating for a change in how we look after doctors in our province because of the fact that a lot of people are going to go through divorces. A lot of people are going to have to navigate kids. And honestly, you only get 18 summers with your kids. Like, I don't think that people that go into medicine, because people are generally so young, they don't understand that. It's, I had my daughter before I went to medicine, so I kind of had another, I had life experience, and I was, she had some medical issues as well when she was born, so I had things to look after with that. But like, the medical system is not made to support healthcare workers who may even have family members to look after, right? Like aging parents. My partner has a family member who I have had to advocate for that has been put in really unsafe situations, both in hospital and through home care. And it's ridiculous. If you are not hands-on, and I don't know what it's like not being a healthcare worker, but like having healthcare needs in the family, if you are not 100% on it, your family member has no one to advocate for them, and there are really bad outcomes. And I have experienced quite a few in the last few years, times when I would have actually had a family member die had I not actually gone in and raised some shit. Anyway, my thoughts today go out to the single parents. I know that there's some other single dads that I work with as well that are really struggling, and single moms, new moms that are trying to navigate healthcare and figure out how am I supposed to work and look after my kids. Sometimes people nowadays, they don't have a spouse that stays home, and a lot of this too is because you come out of school with so much debt, and you come out older, right? So you want to have a family. You can't work 24/7 because by the time you get out, you're almost 30, and you want to have kids or whatever. So yeah, so kind of a long post.
Canada is a first world country, and I know that even you watching this video know that a country as big as Canada should not have such problems. A problem like a healthcare system that is not functional. Canada is too big to have such kind of problems. And would it be that I'm hearing such kind of rants from people probably in Africa or any other third world country, probably in India, then I'd just give the government grace and expect that probably with time they will have fixed all that. But I believe that Canada is a place that most people want to visit, or most people want to live, or at least they used to. When I was still young, it was my dream to live in Canada. Back in Africa, so many people just wished to be visiting Canada, just visiting, not even just migrating to Canada or getting probably a work permit visa in Canada. But as we speak right now, the rants on social media about the Canadian healthcare system and so many other problems in Canada, they are kind of painting a whole bad picture. They're not just staining the Canadian government, they're just staining the Canada as a whole nation. And I don't think this should be the case. Now, from what you've seen, from all the people you've rant about the Canadian healthcare system, do you believe them? Please tell me in the comment section, because on the other side of the story, some people claim that it's a provincial problem and such kind of problems should not be experienced, at least in Canada.